It's so important for us to analyze the patient thoroughly ahead of time to see what it is that is giving them the aging look. Is it just gravity? Or is it hollowness of the skin? Or perhaps are there fine lines that are there that we need to address? And this is part of the evaluation that we do and spend time with patients going over exactly what's happened to them over the years and what we can do to help alleviate those changes and make them look more youthful. And that's the other goal that we have for facelift surgery, is to give people a natural look so that no one knows they've had the facelift and their friends just say, hey, you look great. Did you lose weight? Did you change your hairstyle? Have you been on vacation? What is it? And that's the look that we want, the rejuvenation look that just takes them back to the way they looked several years ago. It's not a different face. It's not a different look. It's just the one they had before, and it looks natural. There are many different types of facelift techniques. I've been very fortunate to have studied and to have used all of these different techniques. That's important because I want to tailor each operation, each technique to what the patient's needs are. And patients are all different. I see some patients with more hanging skin in the neck, or more fullness in a certain area, or perhaps the fat pad has come down more on one side than the other. So just one operation isn't going to address these, one technique. So I want to know all the different techniques, and I've had the experience to having those in my armamentarium. So I'm going to tailor every operation towards the needs of every single patient individually. One of the goals that we have, and one of the things I strive for in every facelift, is to be sure that we hide the incisions. We hide them in the hair, we hide them behind an area here in the ear, and then we hide them behind the ear and then into the hair. We don't make incisions that come down along the edge of the hair that always show, that make it impossible for patients to wear their hair up afterwards. We are meticulous about seeing our patients very often post-operatively, removing sutures before they leave marks, taking care of any ingrown hairs that might occur where the new skin that's been lifted up interacts with where there is hair. We see facelift patients so often post-operatively. It's part of our care. It's part of our surgical fee. We just don't operate on a patient and then see them once post-operatively and then say goodbye. We see facelift patients on the day after surgery. We see them about 3 and 5 days later, a week later, 2 weeks later. We see them very often during the first 3 months after surgery. Then we see them again at 6 months and 1 year. And it's all included in our fee, in our overall fee. I am very detail-oriented. I'm sort of a perfectionist. I don't want anything to show. I want these incisions to heal perfectly well, and that's why we follow our patients for so long afterward, so that they have a very pleasing result, a natural result that, as I mentioned before, only their hairdresser knows about.